Welcome to Fresh Start. Are you ready for health? In this module, we're going to talk about how to fine-tune your life. You can find this module on our website, freshstart.mhsystem.org, under Learn the Basics. Click that arrow, you'll get the drop-down box to fine-tune your life. As we get started, let's consider an old car. If you've ever been to one of those antique car shows, you may have seen cars like on the left. And sometimes driving down the road, you see cars like on the right. Which would you rather be? In a prior module, we introduced the concept of flourishing. Flourishing is to grow or develop in a healthy or vigorous way, especially as the result of a particularly favorable environment. Similarly, the word shalom is a Hebrew word meaning peace, harmony, wholeness, completeness, prosperity, welfare, and tranquility. We want you to flourish and to find shalom. So we ask you the question, would you put diesel in a gasoline engine? No, certainly not. Are you putting the right fuel in your body? We've already introduced the eating continuum and have encouraged you to eat more on the right, those plant-based whole foods. We've given you guidance with the stoplight, to eat mostly from the green light list of foods, some of those yellow light foods cautiously, and to avoid those red light foods as much as possible. We've also given you the guidance to fill up 3/4 of that plate with those foods that are from the green light section, plant-based whole foods, high in fiber and water, and to limit those yellow foods to less than 25% of your plate. Now we want to talk about routine maintenance. For autos, that's changing the oil, rotating the tires, putting in radiator fluid. For humans, that routine maintenance includes those other pillars of lifestyle medicine that we haven't talked a lot about yet. In this module, we want to concentrate on fine-tuning. Are you ready for health? Welcome to Fresh Start. Are you ready for health? We're talking about fine-tuning. We want to focus particularly on the importance of timing. As you eat and your stomach stretches and fills, it takes about 20 minutes to send the signal to your brain that you are full. We can override that signal when we eat fast without thinking, overfilling our stomachs and feeling miserable afterwards. Most of us have been there. This is especially common in people who eat while they're watching television or eating quickly during a short break at work. If that's the case, we want to encourage you to slow down your eating. Think about what you're eating. Practice mindfulness. In the left sidebar, there's a slow down your eating worksheet that'll help you eat mindfully. I'd encourage you to go through that exercise at home. So about 20 to 30 minutes before you sit down for your meal, have a healthy snack, something that's high in fiber and water that will begin to satisfy you and take the edge off your appetite. Then when you sit down to eat your meal, you'll be less likely to go for those seconds or thirds, and you'll feel satisfied sooner, thereby decreasing your calorie intake. Further exploring that theme of timing, we are meant to be creatures of the daytime. Our ancestors were hard workers. They worked outside under the daylight. We too would benefit from that type of lifestyle. But unfortunately, many of us have to work inside and have to work schedules that keep us from a healthy routine. One thing that is helpful is to follow the old adage, eat breakfast like a king, lunch like a prince, and dinner like a pauper. So your first meal after you get up in the morning should be a nice hearty meal full of those healthy, unprocessed carbohydrates to give you the energy you need for that day. Your mid-workday meal can be a bit smaller, but yet full of energy for you to get through the rest of the day. And your evening meal should be smaller, allowing your body to wind down before you go to sleep. I hear frequently from people that they don't eat breakfast. Well, let me encourage you not to skip breakfast. If you do, you're at increased risk of diabetes, heart disease, atherosclerosis, premature death, and your cholesterol and blood sugars tend to run higher. Studies have shown that people who eat the exact same food but shift that food into the morning instead of afternoon or evening have lower blood sugars, both during the day and the following morning. They have less weight gain and better control of weight loss, and they have lower cholesterol. We also want to encourage you to keep a consistent schedule. You'll have better blood sugar levels and better weight control. The concept of fasting is scary to lots of people, but there are multiple types of fasting. It can be simple as just restricting your calories. There's a concept called time-restricted eating, which we'll talk about in more detail. You can also fast 1 or 2 days a week, alternate day fasting, and there's something called a 5-day fast mimicking diet, which we'll touch on briefly. More serious fasting, like prolonged water-only fasting or multiple day fasting, should be done only under medical supervision. Fasting can help with control of weight, blood sugar, blood pressure, and cholesterol, as well as improve brain and nerve health. It is anti-inflammatory in its effect, and it can also help with preventing and treating cancer. The simplest form of fasting is simply portion control. Limit the amount you eat. This is difficult for lots of people, and for many people it leads to failure because they leave the table hungry, and before long they're scrounging for snacks. If you're someone who can do portion control, then that may be very beneficial for you. Ideally, if you're eating those plant-based whole foods, which are high in fiber and water, you'll be filling up, be satisfied, but not getting that high load of calories. There are ways you can engineer portion control into your life. Put a small amount of food on your plate, put away the rest of the food for the future, and you're less likely to go back into the fridge to get a second helping. Another thing you can do is avoid family-style eating. Don't put that big bowl of food right in front of you on the table. At least leave it up on the counter, so if you do go for seconds, you have to get up and make some effort to do so. Time-restricted eating is something that most of us can do and find some benefits from it. This is the concept of eating all of your food within a certain amount of time. For example, you can eat all of your food between 7 a.m. and 7 p.m. and then have nothing to eat from 7 p.m. till 7 a.m. If you tighten up that time period to 8 to 10 hours, you'll find even more benefits. How this works is that your body has this stored energy called glycogen that gets us through about 8 hours. As we sleep, we decrease our glycogen levels, using that for our bodies to do its normal function. After about 8 hours, we have to start burning fat for our bodies to function. So if you increase this interval of time between your last meal and your first meal, you will automatically be burning more fat. If then you add to that in the morning before eating some physical activity like a good walk, you'll automatically be burning more fat for that walk and enhance the effect of the overnight fast. There's another type of fasting that's producing some interesting findings from research. It's called a fast mimicking diet, where people will eat a low-calorie, low-carb, plant-based diet for 5 days, followed by refeeding with a plant-based diet. You can read about this in Walter Longo's book, The Longevity Diet. He has some very interesting research summarized in his book, suggesting the benefits of fast mimicking diet for cancer treatment, weight loss, diabetes, heart disease, and autoimmune disease. There's another book you might want to take a look at called Slim by Design. In the left sidebar, click on Slim by Design, and you'll see a summary of some of the ideas from the book that will help you engineer into your life some healthier choices. These include things like getting out of sight those unhealthy snacks. Instead, put a fruit bowl on your counter. When you open the fridge, what's the first thing you see? Shouldn't be cheese or those unhealthy snacks. It should be some cut up fruit and veggies ready to go. Are you ready for health? We'd like to now talk a little bit about physical activity. In our society, we sit way too much. We spend too much time in front of screens, and we've developed this very sedentary lifestyle which has been detrimental to our health. I want to encourage you to be more active, to stand more, to walk around, to take those breaks from in front of the screens, get up and move. Frequently, I talk to people who believe that exercise is the key to their weight loss. I want to point out that exercise is not a good primary strategy for weight loss. Remember, in a prior module, we talked about for every extra 100 calories you eat in a day, every day, over time, that accounts for an extra 10 pounds. So if you decide to eat those extra calories, how much more physical activity would you need to do to burn that off? For example, that 2-ounce Snickers bar, which I used to eat every day, would require almost an hour and a half of exercise to burn off those calories. A Krispy Kreme donut, an hour. Coca-Cola, 45 minutes. When you think about the average American is consuming 500 calories in excess a day, that's like 2.5 hours worth of exercise just to eliminate those extra calories. The math just doesn't work. You can't count on exercise alone to help you lose weight. To be successful, you have to decrease that calorie intake. The easiest and most satisfying way to do that without going hungry is to eat those foods that are high in fiber and water. Remember, 500 calories of those plant-based whole foods will fill you up and satisfy you. Another thing to keep in mind is that your body has this weight memory. It remembers what your maximum weight was. And if you change your diet to this plant-based whole food diet that I'm encouraging, and you consume less calories, you will begin to lose weight. Our bodies are tuned to a feast and famine cycle that our ancestors used to have on a yearly basis. Problem is, we don't ever go through the famine. We have refrigerators and grocery stores. So your body will let you lose that extra weight for about 6 to 12 months. And if you continue with that reduced calorie intake, your body's going to sense that the famine's lasting too long and will subtly slow down your metabolism, and your weight loss will plateau, and you might even begin to regain the weight even though you're on the same healthy diet. The only healthy way to overcome that is to increase that level of physical activity. So for long-term weight loss and weight loss maintenance, you need to be doing about 30 minutes a day of vigorous exercise or 60 minutes a day of moderate exercise. I'm not asking you to do anything that I don't do myself. I have to do this to keep my weight off. If I let my exercise go, it starts to creep back. So most days I start out with a nice walk at a pretty good clip for about an hour. Another way to help motivate you to do more exercise is a step counter. Your phone likely does this for you, or you can buy a separate device called a pedometer. If you're able to walk for physical activity, we would encourage you to work yourself up to at least 10,000 steps a day, and even more is better. If you get even 6,000 steps a day, you'll be getting some benefit. Another helpful way to utilize fine-tuning to improve your health is to plan some physical activity that first hour after eating, especially if you're concerned with blood sugars or weight loss. When you eat your meal, that first hour after eating, the blood sugar level goes up. If you're then sitting in a chair, your body senses that you don't need that sugar for energy and it converts it to fat. If you have diabetes, that high blood sugar causes damage in your eyes and your kidneys and your blood vessels. However, if you can exercise even 10 minutes after your meal, your muscles would consume that blood sugar and bring down that spike, thus helping you control your blood sugars and your weight more effectively. Are you ready for health? A common question that I get is, should I take supplements? My answer is, it depends. It depends on what you're eating and what your doctor says. Generally speaking, if you're eating this plant-based whole food diet, you won't need much in the way of supplementation. When I recommend a plant-based whole food diet, people often ask, well, what about my protein? What about my calcium if I don't consume dairy? Well, you only need really about 5 to 10% of your calories coming from protein. Most Americans eat way more protein than they need, and it's mostly animal-based protein, which is packaged with cholesterol and saturated fat that causes damage to our hearts. Eating those high-protein diets that are animal-based also increase our risk of cancer. So where will you get your protein? Well, beans have about 25% protein. Broccoli has about 26%. You'll get all the protein you need without even thinking about it if you eat the broad-spectrum, plant-based whole food diet that we're encouraging you to do. Well, what about the calcium? Don't you need dairy? And the answer is the same. No, you don't. You'll get all the calcium you need from beans and greens. Well, what about vitamin D and omega-3 fatty acids and multivitamins? We hear lots about those. First, for multivitamins, you probably don't need those if you're eating a plant-based whole food diet. The same goes for those omega-3 fatty acids. The omega-3 fatty acids function by helping offset the omega-6 fatty acids, which are high in the animal-based products. However, if you're eating a plant-based whole food diet, you have very low levels of omega-6 fatty acids and therefore don't need much omega-3 fatty acids. You'll get probably all you need in the food that you eat. Well, vitamin D is a bit tricky. Studies are coming out showing that taking vitamin D when you already have established disease doesn't seem to help reverse the disease. However, other studies show that deficiencies in vitamin D are associated with many of the chronic diseases like diabetes and heart disease. These studies, however, may really be pointing to a common cause. The low vitamin D levels may be coming from the same things that are causing the diabetes and heart disease, rather than one causing the other. Until this is sorted out, Dr. Greger at nutritionfacts.org has some recommendations that I think make sense. If it's a time of year and a climate where you can get good sunshine, try to get about 15 to 30 minutes of sunshine a day. If you're not able to, or if it's the winter, then 2,000 units of vitamin D a day may be helpful. 3,000 units if you're overweight. When you look for a supplement, D3 is better than D2, and it helps the absorption if you take it with the largest meal. There's some other specific supplements we'd like to just mention. Vitamin B12 in particular. If you're over age 50, or you're eating a completely plant-based diet, or you have an absorption problem in your intestinal tract, you may want to be taking B12 on a regular basis. Vitamin B12 is essential for health. It helps in blood cell formation, it helps with your neurologic system, and in your gastrointestinal tract. Vitamin B12 is produced by bacteria. We get it in our animal products for contamination in food. Our ancestors used to get it from the water supply or the soil. The body has a long-term supply of vitamin B12 in our livers. It takes over a year for a deficiency to develop if you're not taking vitamin B12. So vitamin B12 is especially important for those who eat a completely plant-based diet, those who've had bariatric surgery or other surgery on their small intestine, people with Crohn's disease, other things where they have poor absorption, and for people who are 50 plus years old. It's best to get a pure supplement of cyanocobalamin rather than a multivitamin with vitamin B12 in it. Adults should take about 50 micrograms a day or 2,000 micrograms weekly. That math seems a bit confusing, but it's because absorption is limited with larger doses. But for some people, it's easier to take a once-a-week dose. If you're over 65, 1,000 micrograms a day is recommended by Dr. Greger. If you have an absorption problem, a sublingual form is best. Turmeric is another interesting supplement. If you look in PubMed, where the medical literature is, there are thousands of studies published on turmeric, and the number continues to be added to regularly. Turmeric has some interesting anti-inflammatory effects. It's helpful in treatment of autoimmune diseases like Crohn's disease and rheumatoid arthritis. It's helpful in pain management. It's actually equivalent to a low-dose statin in lowering the cholesterol levels in the body without the side effects that a statin can cause. Turmeric also helps stabilize blood sugar. Although the dose varies in the studies that are published, recommendations are in the range of about 1,500 milligrams per day. That's 2 to 3 capsules depending on the size of the capsule. Ideally, take this with food because it's absorbed better. And if you add black pepper to the food that you're eating, it helps keep turmeric in your bloodstream longer. Flaxseed's another interesting supplement. It's shown to be helpful with things like cholesterol, triglycerides, blood sugar, blood pressure, constipation, cancer, and inflammation. In the left sidebar, you can download an information sheet on flaxseed, as well as many of the other supplements we're talking about. And I'd encourage you to consider going to nutritionfacts.org and looking at the various resources they have on these different supplements. Flaxseed does provide some of those omega-3 fatty acids that we've already talked about. To get the therapeutic benefits from flaxseed, such as helping with blood pressure, it's recommended that you have 2 to 4 tablespoons a day. This can be added to a salad, mixed in with your oatmeal, or added into other foods that you're preparing. You want to use ground flaxseed. The whole flaxseed oftentimes will pass through your system without any absorption of those omega-3 fatty acids. Once you grind it, you want to keep it cool because those acids that are then exposed to air can go rancid over time. Ginger is another interesting supplement. It's been shown to have some benefits in treating nausea, motion sickness, migraines, headaches, and pain. It's something you can easily add to your oatmeal and other foods for flavoring. You can buy capsules to take, augment the effects of things like acetaminophen for a headache. And cinnamon is also an interesting spice that not only helps make your oatmeal taste better, it might help with your blood sugar control. It is an antioxidant as well. There are 2 types of cinnamon that are marketed. One is called cassia or Chinese cinnamon, and the other is Ceylon cinnamon. It's the cassia or Chinese cinnamon that is most effective. However, you don't want to take too much of it because it has a side effect of acting like a blood thinner. So you probably want to limit that to no more than a half teaspoon a day. Generally, however, other than vitamin B12 and possibly vitamin D, you don't need any of these supplements if you're eating a plant-based whole food diet. There might be special cases where they would be beneficial to you. We'd encourage you to discuss those with your primary care provider. So what's the dosage of that plant-based whole food diet? We want you to be eating about 40 grams of fiber a day or more, at least 75% of that plate filled with those foods rich in fiber and water, and a cup of beans a day. We encourage you to minimize those animal products and processed foods. Avoid eating those large meals and snacks in the evening, especially late. Try to fast for at least 12 hours during the night. You can exercise before breakfast after that fast, and then again during the day after your meals to help bring down your blood sugar. If you like to walk, we'd encourage you to get a pedometer and work up to 10,000 steps a day and more. To keep that weight under control, we want to be working toward 30 minutes a day of vigorous exercise or 60 minutes a day of moderate exercise. So now it's time to write your goals. You can find a goal sheet to print on the left sidebar. We encourage you to pick some of these goals that make sense to you. Are you ready for health?